Hi, my name is Dr. Tiffany Manuel, and I'm the president and CEO of the CaseMaking. So for those of you who've been participating in the Catalyst Case-Making workshops, I just wanted to get online really quickly and give you an update about where we are, number one. And number two, give you a bit more information about sort of what's coming next. I know some of you are really excited about the webinar that we had at the end of January, and I'm really looking forward to kind of the next step of sort of understanding how to build an effective case around the work that you're doing. So before I do that, I just wanted to take a moment also and just say thank you to the folks who are organizing us, the folks at Rethink Health and the Ripple Foundation, who've been generous enough to give us some time and some resources to actually spend some time together thinking about the case that we're making around health and health promotion and what that looks like in various parts of the country. And so thank you to our colleagues there for being able to do that. So next step. So we had a great webinar at the end of January where I talked a little bit about what does it mean to begin to make a case, right, for systems change, especially systems change that folds into or builds in equity and inclusion, that does that in an equitable and inclusive way, which can sometimes be tough to do, to have that kind of systems change in ways that really build in equity and inclusion from the top of the work. And so we talked a lot about what is backfiring in the way that we are trying to advance, right, this work out in the field, often in our messaging and communications, even in ways that we may not always be present to, right, how we are challenged by what we're trying to advance. And then I talked a little bit about why some of our work is backfiring. So the next phase of this work is really to talk about how we turn that around. What are more effective ways of advancing a case around a health, and how do we use that to build public will to support the kind of work that we think is really important for improving our communities. So that was the first step. The next step is that we are going to be gathering in Chicago, all an in-person convening in May. So hopefully you all have that on your calendars already for the end of May. And in that session, that's going to be an awesome session. There are two kind of major components to that in my thinking around that. The first piece is really about really talking with you all about what are the sort of evidence-based practices around case making, what helps people to lean forward when we're trying to have very difficult, kind of somewhat challenging conversations with folks about equity and about, long-term disinvestment in communities across the country and what that has done to people's sense of health, and why we're seeing these kind of health disparities show up across the country, or why we need to rethink, risk contracts, or why we need to rethink, how we are advancing and financing kind of health as an issue, or why we need to be thinking about the social determinants. Some of these conversations are really tough to have, especially when they're happening with the broader public, which is often sort of doesn't have the same appetite for data and for evidence in a way that we might, the way that we might show up otherwise and sort of present. So we're going to talk about what are those evidence-based strategies and how we sort of embed those in our work. And then the second piece of that is really about how we are talking with each other, the sort of peer-to-peer learning about what we're doing across the country. And you're going to have a chance to be in a room with other catalysts across the country who are making the case for change across the board. Some are making the case for change to federal policymakers. Some are doing that for state and local policymakers. Some folks are doing that with investors. They want folks to invest in health and health promotion in a different way than they have before. Some folks are working with their community partners. They want the United Way and the YMCA and a whole bunch of other folks at the local level to lean into something. Or many of you are actually trying to advance cases that are trying to get folks outside of the health sector to invest in the health sector. So folks in housing and education and human services to lean into health in a different way, or at least to collaborate in cross-sector alignment with us in a more profound way. And so, the second piece of that May workshop is really going to be the opportunity for all of us to be in the same room talking about the exciting work we're doing and how we are advancing that conversation with those audiences, which is going to be something to see. So in the meantime, in order for me to be able to prepare for that May workshop, one of the things that I asked you all to do on the webinar last time was to start to send me some information that gives me a little bit more to work from in terms of understanding what you all are doing. So it's useful for me to understand kind of what you are actually doing in your work why you think we should be advancing your work. What's the why of your work, and then who you were talking to. If your case is being made to federal policymakers or local investors, or maybe to Medicaid, or public services groups, or whatever that looks like. Tell me who you're talking to, which will help me understand how to best bring forward examples and case studies that I'm seeing across the country about what it means to make an effective case to those kinds of stakeholders. So as you think about this next piece of the work, it's not for me to take and sort of say, this case doesn't work, you were doing it wrong. It's really for me to take the case and say, what are you trying to advance, and how can I bring examples to our conversation in May that kind of really help to spark discussion. So as long as you're sending me that information, that's great. That can be any kind of materials that you have about your approach, what you're working on, why you think that's the best approach. Any of that kind of stuff would be helpful. And if you send me something and it's a little, and you've got just a little bit of something there and I don't quite get it, I will probably just email you and say, hey, can we jump on the phone for like 15 minutes just to give me more information about what you're trying to do, so that I can bring those examples and case studies forward. So that's really it. There's no sort of specific thing I'm looking for, like you got to have a research paper and a marketing document and this. Like there's no sort of very specific kind of document I'm looking for. It's really just enough that will help me to learn more about what you do and why it matters, and who are you talking to. So if you'll do that, that would be great. I'm happy to do some preparation, a little bit of homework myself before we get to the May convening, because I'm ready for a great time, both in terms of meeting all of you and talking about what you do, but also in terms of sharing kind of the ways in which we can do all this case making stuff a lot better. All right. I'll see you soon. Looking forward to seeing you in May and seeing what you send me to my email address, Dr. T@thecasemade. See you soon. Bye-bye.